Linda Rodriguez, who's the Human Services Administrator of the Boston Division, and Gracie Washita, who's a foster care licensing social worker. Good morning, ladies.
Good morning.
Well, we wanted to bring you on because I just heard anecdotally talking to a friend about how your division was trying to place foster kids during the PCOR 1 lockdown. So I don't know all the details, but right away I thought let's get them on and get an update on the situation with the foster care program. So if we could just start there, Linda, and then we'll ask some questions.
Okay. Well, first of all, foster care falls under the Bureau of Social Services Administration. We're also known as BOSA,
Right.
and we're part of the Division of Public Welfare, of course, under Public Health. And Child Protective Services, also known as CPS, is one of the sections that falls underneath BOSA or within our bureau. So CPS sort of serves the entire population of Guam, including the military population. So we investigate all referrals on child abuse and neglect. So if we do get a report and we find out that children are in imminent danger, we exert temporary legal custody over them. And of course, we work with the courts on trying to get jurisdiction over them. And our foster children range from birth to 17 years of age. However, jurisdiction may be extended by the court up to age 21. So currently we have about 355 foster children under our temporary legal custody. And of the 355 children, there are about 258 foster children that are of Chamorro descent. Our next highest population would be our Chickees foster children, which is about 54. And then the next highest rate would be 24 Filipino children. The remaining children are like from the other outer islands, basically. So we are always looking for foster parents who are willing and able to care for a child on a temporary basis. And I do want to emphasize it's only on a temporary basis, because we really try to work with parents on trying to reunify their children. A lot of parents have drug or alcohol issues, so it does take time for them to get into a program and to get assistance. And of course, there's always like some of them that might relapse. So these children need to continue to remain under our custody and remain in foster homes. So we have a very large teen population, which consists right now about 116 adolescents. Many of them have gone through our sanctuary co-ed shelter. Some of them have been placed in foster homes, but this is the group that is really hard to place. Younger children are more easier to place in foster homes than the teenagers. So it's kind of sad though, like if they are in sanctuary and they do sort of act out, and if we don't have foster homes, what usually happens is that they end up in DYA. And that's like a correctional facility. So it's not really appropriate for these children to be in that kind of facility, because they really need a home that's going to provide them love and support and some sort of stability. When we exert custody over children, we have found recently that we also have been exerting children that come from large family groups. So we have had difficulties placing children together, and our preference is to try and always keep children together, especially when we remove them from the home, because it's really a traumatic experience. But if we do place them in a foster home, we try to put them together, um, and or at least try to maintain them in close proximity to each other. And of course, we try to encourage visitations between the children. Unfortunately, with the pandemic going on right now, we can't really do that, especially since we are now in PCOR 1.
Right.
So a lot of the contact is done through phone calls or virtual, um, you know, Zoom calls, but it's not really
Ideal.
um, ideal, yes, for the children or even for the parents, because, you know, it's difficult sometimes to talk through a screen. So a lot of parents miss their children and they really haven't seen them since March. And, you know, we try to accommodate them as much as possible. We try to set up Zoom calls with them, but it's not the same thing as seeing your child. It's really heartbreaking.
It is. This
So,
whole thing is heartbreaking.
Yeah.
Can we just
So
jump
right now,
right now?
we have about, well, I also want to emphasize that when we do exert custody over children, we try to place them first with relative placements, whether it's a grandma or an aunt or even a godmother. And right now we have about 172 children out of the 355 that are in relative placement. Um, with foster parents, we have 41 licensed foster parents, but not all of them are active. We only have about actually 27 foster homes that have taken in our children, and that's only about 60 kids that are in licensed foster homes. The remaining children are either in group homes like Sanctuary or Ollie Shelter. They also might be in a non-relative placement. Um, this is a placement where children aren't related to the people, but it might be somebody that they know, like a godparent or a distant aunt, or even a very close family friend. Um, let's see, what else could I tell you? 21, okay. Oh yes, and we do have some children that have been returned to their parents' custody. We were working on reunifying these children, but just because we return the children, it doesn't mean that we don't have legal custody over them. We still monitor the children in the home. And so there are about 21 parents right now that have physical custody over their children. And this includes 47 foster children. So right now, our office is closed to the public, but we still are receiving referrals. And if there is a child that is in imminent danger, we do still send out our crisis workers, and we do investigate those cases. We also have case managers that are here at the office that are also monitoring the children that we do have legal custody of. We don't tell them to go into the home, but we do encourage that they follow up with the foster caregiver or the relative placement or the parents, just to check and see how they're doing.
Right.
There might be some situations where we will assist the family, like say if a child needs to get through a medical appointment or some kind of other service. We still try to interact with the families, but we don't actually try to go out unless we absolutely have to, because we have to think about not only the safety of the children, but the safety of our staff. And okay, so I know Gracie has been working to try and recruit more foster homes for our children, because we
Right.
want to get children out of the Ollie shelter. We want to get them out of Sanctuary, and we want to put them in a home where they can actually have somebody to provide them love, support, and stability. So, like I said, we're always looking out there for the community to come forward and volunteer to be a foster parent. Right now, our foster parents are tapped with a lot of our foster children on an emergency basis. We don't have a lot of foster parents that we can rely on that will take in children because, like I said, they've already meet
Right.
the maximum amount,
Yeah.
and they will take them for a couple of days for emergencies until we find another home. Um, just to
So-
make it real, like this week alone, we had an adolescent whose placement broke down, and um, it it broke down on Monday, and we still haven't found a home for him. So we were able to find somebody to take him over the evening, but it's really difficult to find homes for teenagers. So with that and that said, we could I could ask Gracie to sort of explain to you what it is we're looking for.
Right. Let's just get the numbers again if we could, Linda, because you threw a lot of stats out there.
Yeah.
How many kids are we
Yes.
trying to place right now? How many kids are in the group homes or the shelters that need to get into a foster home?
Well, our shelters are pretty much full. Our Ollie shelter has 14
Yeah.
right now, and I understand they are understaffed, so they're really struggling to keep our children safe. Sanctuary also has, I think, about 10 of our children, but they also have children from the other, like other within the community,
Right.
right, that need emergency assistance. But they try to help us out as much as we can. But we just need the community to come forward, and take in a child. And sometimes it doesn't have to be long term. It could be like for a week. It could be a couple of nights. But we really need the community's assistance out there. And especially when the pandemic broke out, it was really difficult for us. Things kind of slowed down after Core 2 came on, but it seems like we're like really in a bad spot right now
Right.
because we just don't have enough foster homes for these children. And it's really difficult sometimes to place kids,
Right.
and I know when we call our foster parents, they really don't want to say no, but they just can't take in any more children. And we don't even recommend that they have a lot of children because it's going to add a lot of more stressors, and then placement's going to break down, and then we're going to have to remove
Right.
the children, and then we're going to be in a predicament where we're going to have to be calling everyone again to try and find kids.
Have we seen an increase in the CPS complaints that remove the child from the custodial care of their parents since the beginning of the pandemic?
Not really, because like I said, we receive a lot of referrals, Chris, and of course CPS can't touch all those referrals. We would love to touch them all, but we can't. So we do look into the referrals that are severe and where we think the child might be in danger. Those are our priority. Most of our referrals come from the Department of Education, but we all know that since the pandemic broke down, children haven't been going to schools. So, of course, our referrals have gone down, but it doesn't mean that the abuse is not still happening. It's just that our reporting parties don't have access to the children and they can't observe. We are getting a couple of referrals in, but like I said, it's not the big numbers that we used to get. But, it doesn't mean that abuse and neglect has gone down. It just means that it's not being reported.
Yeah.
We do have some relatives calling in if they do see something like physical abuse. we do get some calls from the hospital on medical neglect, but really, we just really don't know how many children are out there that are being severely neglected or abused right now.
So what do we do to get to these kids who are? I mean,
Well, like I said, if anybody calls in, we still look into those referrals on the referrals that we're getting.
right.
Um, but of course, the teachers they can't report because they're
Right.
not in school.
Yeah.
We do get some referrals from GPD. Of course, that is reported to us, or like I said, relatives. So,
So what is
but we're
one
trying to best we
for
can.
somebody
I'm
who's
sorry.
listening, watching this program, and they want to step up, they want to volunteer to be a foster parent. How long does this process take? What do they need to do?
Okay, that's what Gracie will explain to you. She is our licensing social worker for foster care, and she knows all the requirements on what people need to do to get licensed.
Thanks, Linda. Yes, so anybody who wishes to, who has an interest in becoming a foster parent, they can always contact our office. And, I'd be more than happy to just talk to them about the process. But yes, there's an application process, Sabrina. So the application is available on our public health website, or they can call our office. I'm more than happy to email them the application or make accommodations to, drop it off to them. But yeah, some of our requirements, of course we have to ensure that that home is safe, right, and stable. So we do require, certain clearances like police and court clearances, medical clearances. We also ask for financial information because, we need to make sure that, taking a child in is not going to be, it's not going to take a financial toll on that family. There's also, we require character references. I have to conduct interviews with the individuals who are, applying to be foster parents, and I have to meet the household members. We also have to, of course, conduct a home visit to ensure that that home, meets, it's safe and appropriate. But yeah,
Right.
but you can, anybody, if you're over 18 and you have the compassion, you're patient, you have flexibility, you can call our office, and like I said, I'd be more than happy to talk to you about it.
Right, but are you
But
guys
yeah,
able to do these checks, and can people ideally go out in PCOR 1 and get all these clearances? I mean, how does this work under COVID, under PCOR 1?
yeah, so I know that, so right now, for when the pandemic started in March, some of our applicants or people interested, they did have some difficulty, of course, getting the police and court clearances and getting their medical clearances. But as soon as some of the restrictions were lifted, they were able to get those things. But if we really do need an emergency home, and a family is not licensed, but we've been having conversations with them, and we're able to assess their home, and CPS has a system in place where they can do some background checks,
Okay.
and we can do an emergency placement. But of course, we want people to be licensed, right? So we have been getting applicants. I'm actually working on licensing 4 families right now. But yeah, that's one of the difficulties right now, is obtaining like police and court clearances,
Yeah.
Right,
because
yeah.
those agencies are not open to the
Yeah.
public. Hopefully those can be restricted.
It's got to
But
be.
just going back to the application quickly, like Linda said, there's different types of foster care. So if people are not able to provide 24 hours a day, 7 days a week type of care, they're willing to do something on the weekend or something short term. That's possible, and it's really up to the individual who applies. Like, if they have a preference, do you prefer males, females, how many children do you want to foster? What's the age group? So there's just different types of, help you can provide. Whatever you can do is appreciated.
Okay.
It's got to be a struggle because I know the director had just, your guys' director had wrote a letter to the governor talking about the latest budget and telling Adelup that foster care payments under this budget would be discontinued from January 2021 to September 30. Also, that the Ali Shelter 1 and 2 services for abused and neglected children would be discontinued from January to September 2021. It sounds like we're already in a crisis with the foster care, and it sounds like it's only going to get worse.
Yeah.
Yes, that is a great concern.
Well, we've got the info, ladies. Very alarming. I think we need to do another follow up with this issue and but maybe get into a little more detail about like the home requirements for people who are trying to foster kids. Because I've heard stories about people who really want to help out because they were maybe in similar situations when they were kids, right? I mean, I was in sanctuary when I was a teen. But for whatever reason, maybe they don't have a separate bathroom for a female foster child or whatever the things are. So maybe we can get you guys on again, or maybe Linda, you can shoot me some extra info about that and we'll get the word out. Okay.
Absolutely.
Yeah. In the
Yes.
meantime, but thank you guys for the work you're doing. It sounds like we need to do more work on it.
Yeah.
I mean, especially when you hear
Yeah.
that the teachers, you're right, without school, we forget about this part of this pandemic is without school, a lot of times the teachers, the administrators, the aides, the people on the ground at the school level are the ones who see these kids and see the signs. And we heard,
Yes.
we had a similar conversation during the first lockdown about women who were locked down, staying at home with their abuser. And I can't believe that I didn't even think about the kids. And so this,
Yeah.
it's really alarming, and we're going to do more on this.
Yeah.
Yes. Yeah. So, so if anybody out there suspects abuse, they can always call our office. And it doesn't have to be, the allegations don't have to necessarily be, true. If they just suspect that there's a child that might be abused or neglected, please call our office. They don't have to give their name. They can remain anonymous, but we usually encourage people to give us their name and number so we can get more information if needed. Sometimes they won't even provide a name or an address. So of course we can't expect to go out there and investigate. That's why we do encourage people to at least give us a contact number so we can get additional information and look into the allegations.
Thank you, Linda, Grace. Thank you guys for the work that you do, and we hope you get the help you need to do it better.
Yes. And thank you very much, Sabrina and Chris, for giving us this opportunity to reach out to the public and try to get more assistance for our foster children. We really appreciate it. Thank you very much.
Right on. Okay,
Right.
guys,
Take care.
be
Be
safe.
safe.
All right. Thank you.
Okay.
Okay.
We're gonna go ahead and close the show out with. We'll just run through the
Yeah.
COVID census and again the number 475-2653 or 2672 to get hold of the Bossa Division of Public Health. Where it sounds like a crisis to me, and I'm not really satisfied with the level of response that we're getting on this issue because of this PCOR 1 lockdown. It seems like that it should be more essential.
All right, and word from Adelup and I guess Public Health that
They're gonna get cut more.
yeah.
Yeah.
And also, we just heard during our show the other saddening news that another person had died from COVID-19. This is the 30th individual to have passed away. 72